Can you describe goals of phase 1 and phase 2?
Oh, yeah. Well, the phase one goal is nasal breathing. That's number one. So you have to take whatever that child is doing and have them be a 24-hour a day nasal breather. So lip seal nasal breathing is goal number one. In fact, if you have only one goal, that's the one. So if you want a short list and you want to just accomplish one thing for a child early, it's nasal breathing. So these kids are walking in mouth breathing predominantly. And the more the parents observe and the more you're observing and the more people are paying attention, you start recognizing, okay, there's a lack of nasal breathing. Now, the nasal breathing delivers the secondary problem of it with the mouth, with the lips are not sealed and the mouth is open a little bit for compensation, it takes the tongue right out of the picture. Now the tongue is really finishing being trained to stay low and out of the way for the airflow. So the early lack of development delivers the compromise in the nasal chamber. Now you're going to be mouth breathing, which is going to make your growth and development worse because now your mouth is taken out of the picture. Goal number one, regardless of the age that we meet the child, the phase one, goal number one, nasal breathing. And then goal number two is the tongue. And we have to, that's the myofunctional therapy. I put the tongue first because it's the big culprit, but technically it's all of the muscles. So that's why it's called orofacial myofunctional therapy, because oro is mouth, facial is face. It's the entire set of musculature is misbehaving. And with the entire set of muscular misbehaving, what happens is the face grows differently. It doesn't grow wide, it doesn't grow forward, it just kind of drops straight down kind of thing. So we have this lack of forward and wider growth. Well, the tongue is the primary issue, but when you're dealing with the orofacial myofunctional therapy community, they recognize, and they're the experts at this, so we send the kids to them to work with them collaboratively. They have to work with the entire head and neck. And that means that the weaker muscles have to be strengthened. But the muscles that were compensating are now stronger, they have to be reduced. So it's establishing balance and proper function. So it's not just every muscle gets strengthened, it's the weaker muscles get strengthened, the stronger muscles that were compensated get reduced, and you need a balance where all the muscles are functioning properly. Basically, when you have proper tongue function and position, you're going to grow better. So that's where that becomes number two. So one is going to be nasal breathing. That's the primary goal. Number two is going to be the tongue, and then slash orofacial musculature for proper balance and function. And then number three is eliminating all the habits that might come with this, because a lot of these kids have habits that get in the way of things, chewing on things, sucking on things. And habits include non-nutritive sucking. So when we think about straws and fingers and sleeves and pens and remote controls or whatever's in their mouth. So there's this list. That's your early goal list, is nasal breathing, tongue musculature, and habits. You're getting your way towards, well on your way towards doing something nice. The idea is phase one is about the foundation. Phase two is about the teeth. So by the time we get to phase two, we should have a child who has, basically full foundational growth, a very mild class one malocclusion. I'll call it class one because it shouldn't be class two or three by the time you get to 12. That should already have been outgrown. And then when we have a class one, we should be in a position where proper arch form, proper arch width, beautiful inclination, a nice overbite, a nice overjet. You got your canine guidance, you got your intercuspation. You're going to have like a typodont you're looking at, but with minor tooth issues that need to be aligned. So very nice for clear aligners, or you can use 6 to 8 months in braces. The teenagers that we treat, when we've done phase one early, when we've got the foundation, we've got the breathing, we've got the musculature, all the symptoms are gone, when we've got that healthy child. 12 to 14 years old, what we're deciding upon is, are they going to do 8 months in clear aligners, or are they going to do 8 months in braces? Which is it going to be? The kid who's responsible is going to get clear aligners for a few months, and they're going to get their 4 attachments maybe. The kid who's not so responsible, they might be put into braces for alignment. And so we'll put on braces for 6 or 8 months to finish the alignment of the teeth. Phase two is really just aesthetics. That's all that is. Phase two is no longer growth and development. Phase two is no longer symptom. If you've done phase one appropriately, you've got the healthy child on your hands. Phase two should only be basically tooth alignment. Foundation early, teeth second, and you get results that we're basically seeing day in and day out now.